Yesterday in our series on cancer, you met Maria. She has cancer of the esophagus. Her condition is stable right now, but she worries about what if.
What happens if it comes back, and what happens if I die, and what happens to the children? I think every, how can I say, patient, not just cancer patients, but anybody who lives with a chronic illness, you worry about what if, the what ifs, what if it comes back?
The what if Maria is talking about is what if treatment doesn't work? We've been telling you about the services and people who help while you're fighting cancer. So you may be comforted to know there are also incredible people there to help when treatment ends. We're joined in studio by Dena, the Executive Director of Hospice Toronto. We also have Dr. Gary Rodin, the head of the palliative care department at the Princess Margaret Hospital in Toronto. And that's when you come in, right?
We hope so.
You hope so.
Often we don't get referrals as quickly as we'd like, and I think that's one of the big challenges of providing good end-of-life care, is ensuring that we get timely referrals and that hospice and palliative care gets in as soon as possible.
I found it very, very interesting because 90% of patients who get to this point will say to their general practitioners, where do I go from here? What do I do now? Are those GPs saying, this is what you do? Are they referring people to Dena? Are they referring them to you? What's happening?
Well, one of the things we've tried to encourage is early palliative care, so that actually we don't wait until the treatment ends. Actually, right at the time of diagnosis of a serious or life-threatening illness, there may be room for palliative care. All of the psychological changes that occur when you're diagnosed with a terminal illness, there may be pain, there may be symptoms. We try to help people live, actually, well at that period of the time. So it occurs collaboratively together with active treatment, and then will continue, through the stages of the disease to the end of life.
Because while, in many cases, while treatment has ended, palliative care, people could live for a year or more in some cases.
Well, and end illness is assuming a more chronic profile. And so families are struggling to support someone in the home for a longer period of time. And so the benefits of having good hospice care and good palliative care at the end stages is really important. When you were talking about the family physician,
yes,
it was surprising to me that when I spoke to a friend who was a family physician and said, do you refer to hospice, that they said, what's hospice?
This GP said, what is it?
And so what that says to me is that we're not doing a really good job in creating awareness and creating those linkages, because you're right, the Ipso-Reid study said that 90% of people would go to their family physician, and yet that's not where our referrals primarily come from.
How do you do that?
There's a big process of education, I think, that's required in order for people to understand that all kinds of help is available when you have advanced disease. People are also concerned not only about how to die well, but how to live well. And that's our first job, is when you have a disease like this, is how do we control pain, how do we control symptoms, how do we provide emotional, physical, spiritual support so people can live well, as Dena says, often with advanced disease, and then provide care at the end of life. In order to do that, you have to plan. And that kind of discussion has to occur early in the course of the disease.
Let's talk more about the emotional aspect of this, because you'd be dealing with families who very well might still be in denial, who may not be ready to admit that their loved one is facing the end. So what are your biggest challenges when it comes to that?
I think we're in the moment with families, so we don't push them toward conversation. Hospice volunteers are in the home in 4-hour shifts. So a relationship does develop with the family, and I think that respecting where they are, both physically as well as emotionally, and supporting them, as Gary said, through life. And part of life is coming to terms with the progress of the illness, but information is empowering.
Last word to you, Dr. Rodin.
We help people think in both ways. You have to plan for the worst outcome, and you also have to help people live well in the moment, and I think we try to do both of those things. I think that helps people much more.
Thank you both so very much for coming in. Appreciate your insight.
You're welcome.
If you're looking for more information on cancer care and support, please check our website at canadaam.ctv.ca.